Kevin's Natural Foods brings the flavor and the feel-good in just 5 minutes. Clean, protein-packed meals with flavor that hits. And a feeling that sticks. Get that clean eating feeling with Kevin's Natural Foods. Find us in the refrigerated aisle and at kevinsnaturalfoods.com/try.
Welcome back to Two Docs. We're blessed to have our audience with us again today, and we appreciate you tuning in. It's a remarkable time that we live in. I think unprecedented times, not just over the last 5 years, but over the last 5 months and over the last 5 days. Right, Rennie?
Yeah, the world just keeps spinning, doesn't it? And we're watching amazing things happening that are quite surreal.
What's going on in your life the last week? Share with our audience.
Yeah, well, like everyone, watching what's happening in the news, watching really what's happening in the medical community as well. And thankfully watching a lot of people waking up to things. I think every day people are waking up to the nightmare that is unfolding in front of us in terms of the freedom that we've lost and everything that's happening. So it is good to see people not pushing back against the propaganda in a positive way, not helping the propaganda anymore. I increasingly hear people say, "Oh, this is horrible what's happening. Our media has been taken over. We're not hearing the truth." I play a lot of sports, so I'm out there pretty active on the courts. And this is just the lay public who doesn't know anything about what I'm doing, but I hear them very openly talking about things now. So I think that's encouraging. How about you? What are your thoughts?
Yeah, I think there's been a little bit of a loosening of lips. I've really enjoyed our guest's book, Clayton Baker, Dr. Clayton Baker, who sent me, and I've been kind of skim reading that since I got home late yesterday, and I'm just really intrigued. And of course, he does an incredible job going through the kind of the history of the pandemic and just all these nightmares that coming back to mind, that we all lived through. The lies, the horrible lies, the killing fields. Francis Collins and just University of North Carolina and Ralph Barrick and Fauci and all these horrible memories. Yeah, thanks, Clayton, for bringing those back to me so vividly.
Yeah, we're very excited to have Dr. Clayton Baker join us today. So let's just bring him on because we have so much to talk about, and I'm very excited to hear what he has to say, especially about ethics. So Dr. Clayton Baker is an internal medicine physician, so an internist, who also spent much of his career in the academic world, most recently as a clinical associate professor of medical humanities and bioethics. And boy, did we need ethics during the last 5 years. And we just watched that foundation of ethics crumble. But Dr. Baker was right in there speaking out, advocating for the truth, advocating for informed consent, and has written a great book. So welcome to the show today, Dr. Baker.
Well, thanks very much for having me, Rennie and Jim. It's an honor to meet both of you formally now and to be on your program.
Yeah, I personally was a clinical associate professor of medicine at several medical schools, as you know, and I watched this unfolding. And I have not met you in person yet, but I certainly have read much of what you've written. And you have been a wonderful voice of reason, again, in the world of ethics, in the world of exactly what you were teaching our students. Can you just give a little introduction of yourself, if you don't mind, with regard to ethics and what you were seeing unfold and the concerns you had as the pandemic rolled out and as we witnessed the last 5 years?
Yeah, sure. Well, prior to COVID, I was a pretty conventional physician. Certainly never on the fringe, never in any kind of trouble with anybody or anything like that. Really pretty standard. Always a bit of a contrarian streak, but nothing extreme. And what I realized very early on with COVID was that what was being done in so many ways just absolutely didn't pass the sniff test. The first was locking everyone down, and I'm thinking, well, we have a Bill of Rights, and the Bill of Rights doesn't have an escape clause for a pandemic. The second thing that came to mind a little bit further along with the um, treatment protocols was really what I saw happening with hydroxychloroquine, which was really very early on, and how everything just turned upside down from, oh, this is something we can try, and there are these protocols out there, to know this is a dangerous product that nobody can use. And I knew for a fact, being an internist, that that's not the case. And I had patients with rheumatoid arthritis or other conditions that have been on hydroxychloroquine 200 milligrams twice a day for literally decades. And all I had to do was have them get a eye check every year or two, and this would get refilled without anyone batting an eyelid. But all of a sudden, a 5-day course for someone with a viral infection was going to kill them. And not only that, but they would continue to fill the 90 days with 3 refills for the guy with rheumatoid arthritis. So you knew it was a lie. Anyone
Yeah,
who
that is really very, very similar to my experience, because I'm OBGYN, maternal fetal medicine, and for 46 years I've been treating pregnant women on hydroxychloroquine. You guys would put them on the hydroxychloroquine, women of reproductive age, for autoimmune diseases, which of course were anywhere from 5 to 10 times more common in women than in men, right? So they'd conceive, they'd get healthier, they'd conceive, and they'd come to me. And of course, the CDC and FDA had their stamp of approval: safe, effective, and for in breastfeeding women and pregnant women, all trimesters, and in children, and have that infamous, or famous, now famous, advertisement on their website, the FDA's websites, promoting it in pregnant women. Of course, that conveniently disappeared, Clayton, in 2019.
Absolutely. And I think that was something that was just an absolute smoking gun for me,
Me
because
too.
it just doesn't, the whole issue with ivermectin's not a drug that I prescribe with any frequency, because we just don't see many people with, with the indications for it. But hydroxychloroquine was clear that it was a lie. There was no other way to interpret it, that it was just a bald-faced lie.
And then as 2020 came before us, remember, January, February, March, April, May, 5 months into it, and then we have the horrible Lancet gate and this Surgisphere. How long did it take you to realize that was a total scam?
Well, I became skeptical of the whole operation so quickly that there was just confirmatory evidence after confirmatory evidence. The third thing that really got me was when, because at the time I had kids who were still in high school. And, I live in New York. In New York, the kids were basically kept out of school for 2 years. They went back 2 days a week or some nonsense like that for over a year. And I became very active trying to get the kids back into school. And I was the only physician really the only one that I know of in New York State, but certainly the only one in upstate New York, where I'm from, that was willing to write affidavits or go in front of school boards and all this kind of thing. And, I had friends who got arrested. I almost got arrested once. Our superintendent chose to shut down the meeting rather than arrest the people that were not refusing to stand down. But, I had 2 friends who were arrested. It was absolute insanity. And to me, the notion that so many people would just kind of accept that you go to a school board meeting and, you're not wearing your mask properly, and you get arrested. And people just were like, not sure what to make of that. Well, you really ought to know what to make of that, these are the same people that weren't really that scared of the virus because a lot of them were continuing to, quietly break the rules in little ways. If they, scared to a certain extent, but if they were well and their friends were well, they'd congregate even they were told not to, and so on. So, it was a real education for me at just how fungible everybody's sense of ethics is and how fungible everybody's sense of responsibility towards their own civil rights are. Most people just do not, they demonstrated they just didn't have a willingness to stand up for those things. And it was a thorough education, thoroughly, disillusioning, but that was something that we just saw over and over again. We had a small group of people that would stand on street corners and protest, maybe 100 people in a town of 750,000, and we would make all the noise we could, and we would do all the things that we could, and we sued people, and we had them on the ropes, and then a crooked judge threw out the case, and just all this stuff kind of just played out for 2 years. It was really awful. And I've always been a writer in different contexts, and so I started writing a lot for first for American Thinker and then for Brownstone, and then it kind of accumulated a bit of a following and certainly a body of work that ultimately got collected into this book, The Medical Masquerade. But the other thing that I was doing a lot of the time was simply writing medical legal affidavits and getting involved in lawsuits to get small businesses open, to get the schools open, to get kids to be able to play club sports, all this kind of thing. And what I saw with the whole school thing that was just such a farce was we knew from very, very early on that schools in Europe were open. We knew that they never closed the schools in Scandinavia. We knew for a fact that the death rate for COVID in kids was virtually zero. There's that study from 2023, that gigantic study in South Korea that said that the death rate was less than 1 in 100,000. Of course, your risk of being struck by lightning in your lifetime is 1 in 25,000. So a kid getting COVID, was 4 times as likely to get struck by lightning as to die from that infection. And our schools are closed, even though they're open in Finland, they're open in Sweden, they're open in Denmark, they're open in Ireland. You just knew it was just an absolute gigantic lie. It was an absolute gigantic military operation, really, at the end of the day. It wasn't a medical operation, it was a military.
That's right.
Yeah, and as a pediatrician, I was in Washington State, so I was pretty much opposite side of the country from you, but was seeing the devastation in the clinic from these kids from the lockdowns. They were so suicidal and upset and just devastated by the loss of their freedom to engage with their peers. They were at home. I had kids coming in to my office that literally had not left their house in like over a year. Some of them, as this whole issue progressed, they hadn't even been outside in over a year because they were so scared of this virus that, as you point out, they had a statistical zero risk of dying from. And so, yeah, what we saw was clearly horrific. Thank you for supporting the kids in your community with those letters. Thank you.
Yeah, it was just awful. And you would go to these board meetings, and I think people realized, because a lot of them were done by Zoom and so on, but I think that you realized in 2021 and 22, I think it was mostly 2021, but you realized how dangerous to this gigantic operation a few parents at a board meeting really were. I mean, that's why you get FBI files on you, because you're dangerous. It's like Hoover having a file on Martin Luther King or Malcolm X. You're one person, but you're actually dangerous because people see you, and you can call people out to just what the evil that's going on. And I'm not trying to compare myself to MLK, but I'm just saying, it's astonishing on the one hand, but you realize, and that's actually a good thing, you realize that you if you have some guts and you have some willingness to speak out, you actually do have an influence into what's going on. It's just unfortunate that so few people were willing, to do anything.
Yeah, but that control over us never have happened without other people piling on and helping, right? Without the lay public piling on and helping. So those school board members that were threatening to arrest you for speaking, the administrators at these different schools, all of these people had a choice in the decisions they made during this. And without that, none of this would have been as tyrannical and as controlling as it ended up being, right? I think that we have to remember that it's by staying silent or by actively promoting the opposite agenda, or the bad agenda of this, the silencing tyrannical agenda, that they're really supporting the entire system coming down over us. So fascinating conversation with Dr. Clayton Baker today. We're going to go to ad break. We'll see you back after the ad.
Hello, I'm Brandon House. I want to thank you for all your support at wvwfoundation.com that helps make possible pushing out 24/7 content for free. Without your support, we'd have to put it all behind a paywall. But thanks to you and your support through our foundation, we're able to push it out for free as a broadcast service and broadcast ministry of WVW Foundation. Please consider going there and setting up an automatic monthly contribution, or go there and make an occasional contribution. If you prefer to support us through the mail, you'll find our mailing address there at wvwfoundation.com. You can also call and make your contribution over the phone by calling 901-825-0652. That's 901-825-0652. Again, all these details are available at wvwfoundation.com. Thank you for your support as we try to help people around the world understand the times through the lens of a Christian worldview. Hello, I'm Brandon House. Melissa and I have been taking Bella Grace, this powerful elixir, since last fall, 2023. The results have been amazing. My hands would crack and bleed, deep cuts and cracks every winter for years. No matter what we did, we couldn't get them to stop cracking and bleeding. This year, I took Bella Grace, no cracking, no bleeding. My acid reflux, gone. Haven't had to take a Pepsid. My hair growth, the last 2 times I had my hair cut, the lady had to use thinning shears on my hair. That's amazing. We've also received incredible feedback from you, our listening audience, and the impact it's had for you. This is loaded with astaxanthin. That's a powerful antioxidant. Collagen, but top grade collagen. Studies show 95% of it is being absorbed in the body because of the way they develop it. Then we have something called cat's claw. That's an anti-inflammatory from a vine in Peru. It's the bark, and it's an anti-inflammatory. There are about 80 clinical trials on Bella Grace. Please get a subscription now and save. MelissaHouseBG.com.
Well, welcome back from ad break. We are so honored to have Dr. Clayton Baker with us. And Clayton, give us a little snippet, if you will, of your chapter. One of the chapters I previewed last night was on the 4 pillars of medical ethics.
Yeah, thank you. So one of the articles, or the opening article in the book, is one that I guess to some extent kind of put me on the map with Brownstone. And it was basically a discussion of how all of the key components of medical ethics, which are very well established, as we all know, within the practice of allopathic medicine, have been well established at least since end of World War II, but really since before then, were just sort of systematically dispensed with, just systematically ignored or considered null and void during COVID. And the 4 pillars, if you will, of medical ethics are autonomy, beneficence, non-maleficence, and justice. And so autonomy, which encompasses informed consent, is the notion that an individual patient has the right to accept or refuse any treatment that they so choose. And the notion is that you can't really accept a treatment if you aren't given an adequate understanding of why it's indicated, what the risks of it are, what the potential benefits of it are, and given an opportunity to express understanding, to ask questions, and to get honest answers. So if a person is lying to you, then by definition, it's impossible for you to truly give informed consent because you don't have valid information to work from. If I say to you, I'm going to give you this treatment. If you don't take this treatment, there's a 75% chance you're going to die. when in fact the chance that you're going to die is negligible, or the chance that you're going to die is unknown, how can you give informed consent because you're given false information? Or you can be coerced, and any sort of coercion nullifies informed consent. So it basically takes away your autonomy. And as I outline in the article, we saw people being given a free beer, a free donut, $50, a lottery ticket, any number of a teddy bear, or to be in a sense positively coerced or bribed into taking, for example, the vaccines. Or they're threatened. They're going to lose their job. They're going to be put on leave. They're going to be forced to do a nasal swab every week until the end of time, or they're going to be ostracized. And so, or you can't go to a club, or you can't go to a concert. You can't participate in society. And I don't think anybody who's not completely and totally intellectually dishonest is going to deny that all of those things that I just outlined were done in spades worldwide during COVID. This is absolutely the antithesis. This is the opposite of ethical medicine. This is unethical medicine to the fullest extent you can get it. And that just has to do with autonomy. If we talk about beneficence and non-maleficence and justice, there's all these other ways in which this was breached. Beneficence is the notion that anything that you're undertaking as a medical treatment should provide some benefit to you. So this notion of taking one for the team, the notion of some kid getting a shot they don't need so granny won't die, it's just not ethical. It doesn't matter how you put that. Even if the vaccines did what they claim they did, which they absolutely did not. It's still not ethical to say to blackmail someone into a treatment they don't need for the benefit of somebody else. Non-maleficence is that's the first do no harm kind of concept. And we did absolutely, as a profession, did absolutely innumerable amounts of harm by the millions. Rennie, you were talking about all the kids that were locked up at home and were suicidal and just in absolute despondency because they were kept out of participating in their lives. That's an incredible generational harm on an industrial scale that was perpetrated on kids unnecessarily, completely knowingly and unnecessarily, just absolutely brutal, sadistic behavior. It was sadism is what it was. And I look at someone like Francis Collins, who prances around acting like he's this grandfatherly character, and he's absolutely one of the most sadistic people on the face of the earth. I refer him in the book as the absolute personification of hypocrisy. I can't think of a more hypocritical person on earth than Francis Collins, and he's got competition. But anyway, so if we go through all of these, and then again, justice, justice is in medical ethics terms, it's usually distributive justice. So it's that, one person shouldn't be able to get a treatment that someone else just absolutely cannot get if they need it. And we saw that all the time in COVID too. We saw, even early on, the special treatment that elite people got, the Boris Johnson having parties at 10 Downing Street when the whole country's locked down, Andrew Cuomo giving special treatment to his family, when there weren't tests and so on available to the population at large.
Don't forget Tony Fauci at the baseball game there in 2020, right? Was that
exactly?
That?
I want to
absolutely. Go ahead. I'm sorry.
I want to talk a little bit about what we're seeing in medical education, right? And I know you spent a large portion of your career teaching medical students, residents, interns, just like I have. And what I witnessed was terrible. I'm witnessing, let's actually talk for just a second about the fact that ethics is a class that most people in our country really haven't had, right? If you've attended college, chances are you've never had an ethics lecture in your life. And that's just for the people who've attended college. High schools don't offer this at all. But by the time you reach medical school, you have had some training in medical ethics, at least to some extent, right? And so I think most medical students around the country are familiar with the 4 pillars of medical ethics that you just spoke of, and they have an understanding of that. But what we saw play out during COVID was, like you said, a complete disregard of these medical ethics. So definitions of the terms that were put on the board very clearly for students to see and that were actually accurate, but a complete refusal to discuss how we were breaking every one of those pillars of medical ethics in our society, and watching that play out. And people who spoke up about this just either, lost jobs or were silenced by their peers, or just stayed silent. So we watched so many of our colleagues sitting there literally doing nothing as these atrocities were happening in our own nation. So many people with ethics training like you have, I mean, ethics professors who sat silently and said nothing. Speak to us about that. What are your thoughts with that? How many others have spoken out, that you know of? And what do we do to mobilize these people? I know they know. Many of these folks know they know. Of course, they know. They're teaching this. This is their bread and butter, and yet they stayed silent and did nothing.
Yeah, I think there's several reasons that I can think of, and there's probably others that I haven't considered. I think the first is, it really blew my mind because I mean I was a good medical student. I mean I was in the top 10% of my class at a good medical school, but I was not in a class by myself. There were plenty of bright people around me that did just as well as I did. And so often during COVID, I felt, and again, I don't want to sound like I think I'm anything special. It's quite the opposite. If I could do this, why couldn't everybody else do it? I don't consider myself to be 10 times smarter than the next guy, but I knew right from the start, look, this is a respiratory virus. I'm not a virologist, but I'm a primary care physician, so I deal with flu and virus and colds and adenovirus and all these things every fall, right? What happens to a respiratory virus? If it's new, it comes into the population, it doesn't spread very well, it might make some people very, very sick, and it mutates. And it mutates like crazy because it's a very simple virus. And within a couple of years, it's a cold. And why is that the case? Because a virus wants to live with its host, just like it wants to evolve to survive. If it burns down the house it moves into, it doesn't survive. And that's exactly what we've seen over the last 5 years with COVID. COVID's a cold now, even though it was a biologically engineered bioweapon, it's degraded into a cold. Exactly like everyone who took virology 101 knows. And everyone acted like, oh, natural immunity doesn't exist, or we don't know if it does, or this brand new vaccine that creates immunity for one of the 29 proteins on the virus is superior to actually getting the virus. I mean, these just insane, just absolutely stupid things that were sold to us by Fauci and others, and everyone just shrugs their shoulders and says, okay. And it's the same thing. It was the same thing with ethics. It was like, okay, well, under ordinary circumstances, the ethics apply, but we're in a pandemic. Therefore, whatever the scarf lady and Fauci tell us to do, we're going to do. Of course, a lot of people were bought off. A lot of people were making money off of this, and I think the higher up you go, the more that was an issue. I think that's the other consideration. I know for a fact, I had a conversation very early on with another internist who it was just one of these people you said that just kind of put blinkers on and did what he was told. We had been friends prior to that. And I said, I had a friend who's an orthopedist, and he said at the very beginning of the lockdowns, he and the other orthopedist went to the director of the hospital. This is Strong Memorial Hospital, big, well-known hospital, 800-bed hospital. He said, keep 2 wards open, 80 beds. We'll keep doing our hip replacements. We'll keep doing our knee replacements. We'll keep making money for the hospital. And we can have everyone out in 48 hours if you really need all 800 beds. They never needed all 800 beds. That was another lie. But, and they said no. And I said, my goodness, why could that be? And you realize they're all told, if you do what we tell you, you're going to pay you off the back end with the CARES money. Columbia Presbyterian got something like $600 million in I'm botching the numbers, but in 1 year as sort of payback for doing what they were told. So I think that you get above company grade in COVID, and pretty much everyone's bought off and everyone is corrupt. But I think the lower down people, they mostly just did what they were told because they knew they were going to be made an example of if they didn't. It's really depressing to think about it, but I think that's what happened.
You're absolutely right. It was the actual figure. My research team, including Maggie Thorpe, JD, and I wrote an article on this, and HHS paid out $186 billion with a B, billion dollars, to over 420,000 hospital systems and clinics in 2021. And of course, that all came with strings attached. And those strings attached, you know exactly what they were. And by the way, these are unethical, under the table. Nobody admitted that they existed. These were kept secret from the employees and from the patients that the hospital and physicians were serving. $186 billion. My hospital received at SSM Health $306.9 billion, $306.9 million. They signed that covenant. They had to follow to a T the complete draconian COVID narratives of HHS. And if they didn't, they would have had to pay me back. Pay HHS back. That's exactly why I was fired. And Rennie and I have a firing anniversary coming up here in a couple of weeks. Isn't that right, Rennie?
Yes, we do. We share the same date. I was fired in Washington State for speaking at a U.S. Senate hearing in D.C., and Jim was fired for all the issues he just explained in Florida. So polar opposite ends of the country. We're living in mad times. So such a fascinating conversation. We do need to go to ad break again, but when we come back, we'll pick up where we left off. So please join us. Welcome back to Two Docs on this side of the ad break. As we left to go to ad break, we were discussing medical ethics and how we just watched medical ethics crumble during the last 5 years. We're here with Dr. Clayton Baker having a very fascinating conversation. And Dr. Baker, let me just put it this way. We have an entire generation of future doctors at this point that have been taught that this madness is normal. They have been shown definitions, and I know you and I both very heavily involved in academic medicine throughout our careers. I know Jim has as well. Jim has taught many students and residents as well. This is a nightmare in the making because we have a generation of physicians now that think that this madness is normal. They've been shown definitions on a board, on a whiteboard, or in their booklets, or whatever they're reading, their textbooks, that give a true definition of these pillars of medical ethics. They give a true definition of informed consent, but yet they watch the polar opposite happen during the last 5 years. They've learned that it is okay to force treatments on people. They have learned that it's okay, in many cases, to take parents away from the care of their own children if the parents disagree with what is being proposed for those children. If they're making sound decisions for those children. They have been taught a lot of things that we will not recover from as a nation if we continue down this path. Speak to that, please. And also, what are your thoughts on what we can do to get our colleagues to speak out?
Yes, well, that's absolutely a, a tremendous concern now because the future of medicine is very much at stake. The notion that we're basically going to, it seems like, morph into some AI-driven diagnostic, world, and then the autonomy of the individual patient as to whether or not they accept what the the black box spits out, I think is very much up in the air. I think also, what I saw during COVID, I had a medical student who was doing a rotation with me right when the lockdown started. And the next day, she wasn't there. I was like, where's my medical student? Oh, well, the university pulled her. And this was before they even decided to like make me go remote for 2 weeks or something like that. And I was like, I don't know, I'm not going remote. I mean, I'm a doctor. If someone comes in to get seen, I'm going to see them. If I get sick, I get sick. That's the way it is. And he'd already known that that a lot of the stuff that Neil Ferguson or whatever was saying was nonsense anyway, even at that early stage. But what I saw was that they essentially pulled that generation of students. That's the golden. If that was an honest situation, if that was a true pandemic that they were really trying to manage properly, that's a lifetime opportunity for a student, to be in that situation. It's like being a surgeon and being in a mass unit. It may not be pleasant, but what you learn is absolutely beyond measure. And instead, what they do, they just pulled them out. They just pulled them out completely and just put them in a room and had them study God knows what. And then you bring them back, and now they're still being compelled to get the shots, even though nobody should be getting the shots now, and certainly not 25-year-old healthcare students. So what this is it's now become a litmus test. If you want to go into healthcare, you're going to have to comply, even though nobody else has to comply. You didn't have to comply to go to college now. You didn't have to come. The nurses have already shown they're going to quit if you make them get the shots, so they don't have to get the shots. The doctors don't have to get the shots. But if you're a healthcare student, you got to get the shots still. So what we're in is a very dangerous time where they are programming students to be automatons for this system. I really believe that. It's very disturbing, but the evidence is pretty compelling that that's the case. And I think that what we need to do is we need to get to students. We need to get to young people and tell them this is not right. This is not normal. And I think the other thing that we can do is really explain to people that, I'd like to think it's not the three of us that were primarily responsible, but that our generation and perhaps the generation before us have destroyed the profession. We've allowed this profession to be co-opted by forces like pharma, like the military, like the deep state, and we are not operating as what we claim to be as a profession. We are in service of these other fairly dark forces. And you can either do that and just kind of go along with it, or you can stand up and say, well, that's not the way I'm going to practice medicine, and that's not what I think is right. I do think that young people, I have kids who are in their early 20s. I do think that many young people have an understanding of this. They have a BS detector that hasn't been completely beaten down or paid off yet. And so I think there is an opportunity. But I think we really need to get out there to students and just say, this is not the way it's supposed to be. And I think they also know that they got, pardon my French, they got screwed. That generation of people got screwed as bad as anybody because your formative years were spent in a gulag. And, I think that that's something that we really need to point out, that what was done to you was absolutely wrong. You should be mad as hell, and you should not take it anymore. I don't know how to get that out to everybody, but I think that's a way, there's an opening there. And, I think I can't get over how many kids, a lot of people, a totally different issue, but a lot of people, there's always this back and forth right now with Israel and Iran. Young people don't want a war. They don't want a war. There's people joining the military, but they understand. I think young people understand what's happened to some extent, and they are more media savvy. So I think even though there's been a lot of censorship, as you were mentioning before in the break, the young people, still you're less censored on X or TikTok or Instagram than you are on CNN. And young people don't watch CNN. So I think there's openings there, but it's what's happening is deeply disturbing.
They are, and you're absolutely spot on. This whole thing has just been normalized for these young people, though. They think this is all normal. We used to be able to have these open, free discussions with one another. And they understand now this world of censorship where, oh, maybe they said something they weren't supposed to say, so they got blocked, right? They got pulled off. And they think that's normal. And we can't continue down this path. So I think the message for the public really is that this is happening and it's very real and it's very dangerous and it's very frightening, but it's happening in the shadows. It's happening in the shadows of medicine where you can't quite see it, right? Like you can go to your local school board meeting for the younger age groups and you see what they're bringing home from school and you can have some sense of what's happening in those situations, but the medical schools are pretty closed off. The public doesn't get a chance to come speak. They don't have any way to really engage with the curriculum there. But what's happening is something that we have to turn around. Can you speak a bit more about you were saying something at ad break that I wanted you to share with the audience regarding censorship and the use of social media during all of this?
Yeah, I mean, I think it was, I had a very strange experience with social media during COVID because I really hadn't been on social media prior to COVID. And over the course of time, the only way when they locked you down to meet with people was through the telephone or through social media. And certainly in any kind of organizational fashion, the social media was absolutely um, central. And Facebook was one of the absolute worst platforms, and yet that was how I found out all the information I found out about the groups, the people in my area and in my state, and even beyond. After a while, that's how I found out how to connect with people, and we learned how to do it despite we'd almost joke about so and so's in Facebook jail, so she can't be here tonight, kind of thing. And what I came into was social media equals censorship, because when I got involved in social media, it was a given that it was heavily censored. And it's probably always been censored to some extent, but it was something where my experience of social media has never been anything other than heavily censored. you know, you know, People are always joking about how they're getting in trouble for something they shouldn't get in trouble for. And so that was a real, eye opener for me, I guess, but I've never experienced it any other way. So when you talk about young people saying that this is the norm, I find it, I've been on I'm mostly on X now, and I've minimal, I don't even use Facebook anymore hardly, but it's like, I assume I'm being censored. I don't care if it's Elon or anybody. He's probably better than most. So, I wonder how much that is the case for young people, that they just know, it's the Solzhenitsyn thing, the one life in the day of Ivan Denisovich. You learn to be, he called it, a slow moving, cagey prisoner. You know what I mean? That's kind of how you live, is they're playing games with you, and they're going to shut you down, and which words are going to get you deplatformed, and you don't spell vaccine VICCINE. It's to me, it's just, it's crazy, but that's kind of how I view social media, just because that's my experience. I don't know about you guys, but
Yeah, but without social media, we would have had no ability to really communicate with one another, right? I mean, you look back at times when tyrannical systems have come into power, like in the 1930s in Europe, right? They didn't have social media. So in those days, you had the few people that you knew, maybe the baker down the street, maybe you knew the butcher, but you didn't know these big networks of people. And without social media, I agree with all the harms that it's caused and with the censorship being incorrect and wrong, but it's also had some positives, right? Because we've been able to meet. And if that had completely been shut down, uh, we would have been over. We wouldn't be able to speak with one another and engage, right?
100%. I think that's why they're so terrified, and that's why they were so absolutely, heavy-handed with social media, because I think that, they really can't control it. One of the things I wish would happen, you see this with things like Rumble, or you see this with some of these other sort of alternative platforms, is I hope that there are enough out there so that if you start to really clamp down on one, then people just move somewhere else. I think it's going to be hard for them to, I've actually become very active in the whole geoengineering world, and it's just taking off. I mean, everybody knows now that something's going on in the sky. Everybody knows. Nobody believes the bots anymore that say it's ice crystals. Nobody. And that's because of social media. So I think that, you're absolutely right, Rennie, that it's a blessing. I mean, in the end, it's a blessing, but we realize it's a mixed blessing, and it's something that's constantly being monitored and something that's constantly being used against us. Maybe one of the reasons why I got in less trouble than you both during COVID is I probably wasn't as active enough on social media to be considered to be a risk. I really believe that's probably part of it.
Yeah, I wasn't on social media very much. I don't know how to use it very well, to be honest. I use other
So much
using
for that theory.
well, so much for that theory, but it's worth a try. I think I think it's the whole nature of this has been so surreal watching this play out, and we may end up being at a time and place where we resort to paper leaflets again, like they did in Europe, right? I mean, that at least gets around. People can pass those around,
Well,
but
remember, there was, I mean, social media wasn't around in the earlier part of last century, of course. But remember, propaganda through the news media outlets and through the papers has always been a mainstay of war. It's how wars have always been won, even without Trump tweeting and Iran tweeting and Russia tweeting. It was still present. I think we are coming up to an ad break, so stay with us, and we will be back on the flip side of the ad break with our guest.
We live in uncertain times. In fact, we live at a time when our own governments all over the world are warning us that there could be big problems with our power grid. World War III seems to be right on the horizon. Let me ask you this. Do you have a satellite phone? Should communications go down with cell towers? Do you have a satellite phone to get a hold of that college student or your spouse who travels, whatever it might be, to get a hold of your senior adult parents? We have satellite phones at worldviewtalk.com, and you get the satellite phone for free when you sign up for their very reasonable payment programs for the service. Sign up for the service with a reasonable contract, get the satellite phone for free. Worldviewtalk.com. You'll also find they have, well, what I now have, which is a solar generator. Yeah, I have a gas generator, an LP propane generator, but what if that goes down? I want to back up to my backup. So I now have a solar generator as well. You'll find them at worldviewtalk.com. Check it out today, worldviewtalk.com.
And welcome back on this side of the ad break. We were having an incredible discussion about exactly what has transpired over the last 5 years with the renowned Dr. Clayton Baker, and he's from New York. And Clayton, we were talking about before and during the ad break that we kind of wanted you to address. Is it your perception? What is your perception regarding your colleagues that, of course, in New York are highly, for the most part, liberal, progressive, and swallowed the lie? Are any of them coming back? Are any of them apologizing to you? Are any of them saying, gosh, Dr. Baker, you were right, and thank you for standing out, and sorry about all the trauma you suffered? Tell us what's going on in that regard.
Well, I would say from a standpoint of my colleagues, I think that the awareness that so much of what was going on, that people, hopefully like myself, but certainly you two, called out very vocally right from the start. They're smart enough to understand that our batting average is pretty darn high. I mean, we may not be 1,000, but we're about 900, and they realized that this was an operation that they fell for, and this is an operation that was something very, very bad. I think that I have not had a lot of colleagues come to me and say, "Hey, you were right," but I have been able to see a change in attitude with a lot of people with regarding things like vaccines, with things like um, um, an attitude of lockdown or an attitude of public health as sort of this sort of cudgel that beats the population into submission with. I think that the forces that were behind the whole lockdowns and pandemic and vaccine, they went too far. And I think that average people, whether they're average practicing physicians or certainly average citizens, the average citizens, I mean, I not infrequently get people saying, I mean, I've had people say, "Hey, you're a hero," and it's like my response is typically, "If I'm a hero, we're in big trouble." But still, I've never gotten that from a colleague, but I've gotten that from numerous, lay people. So there's definitely awareness. There's definitely a notion that what we basically were screaming from the rooftops was pretty much 100% correct. But I think there's tremendous cognitive dissonance, particularly among physicians. And, the notion that you were hoodwinked or bullied into harming your patients is a bridge too far for a great many people to admit. That one, I think she was an FDA official, but who came out and admitted, that she had not taken the vaccine herself when she was pregnant.
Dr. Sarah Brenner.
Sarah Brenner, I mean, that to me, and people were calling for her head and so on. It's like, look, she's about number 10,000 for the person that you need their head. Start with Fauci and
Yeah.
Collins and work your way down. But,
I vocally and publicly, and I know Rennie and I have a difference of opinion. Respectfully, we can disagree on certain things, but I hail her as a hero for having. She's a pediatrician, for having the courage to come out and say, "I didn't take the vaccine. I was concerned about what the data that was available."
Well, my difference in opinion with Jim, and it's fine that we disagree. My difference in opinion lies in the fact that she was in a very senior position at the agency where she could have said that publicly at the time and saved countless lives and not just safeguarded her own health. And I realized she wasn't at the top of the food pyramid by any means, but she was in a position of power. So that's where we disagree. But I am thankful for people like her for speaking out now, because she didn't have to say that now. She could have kept that secret hidden. And for the fact that she spoke out now, I applaud her and I commend her and I would support her. But we need more people like her to step out.
Exactly. And I think that may be an opportunity, is to say, look at, and I'd stop short of hailing her as a hero, but I would hail her as a flawed human being that's trying to redeem herself, which is an admirable thing in its own right. And that's what really all of us are at some level or another. So I think that, that's to me a case like that is an opening. It's an opening to say, if this woman can come out and say this, and she's not going to be destroyed, she's going to survive. You guys have suffered tremendously professionally. I got a little lucky. I got a very good lawyer, a very aggressive lawyer, and I managed to get people to back down when I got in a little trouble. But, that's the way the cookie crumbles, I suppose. But, we're all still standing. And, that's something that I think we need to tell our colleagues. You know what? I went through hell and back. You went through hell and back. You're still going through it, Rennie, with your lawsuit and so on. And we're still standing. So it's really time for you to grow a pair and stand up and say what happened here, even if you don't take responsibility yourself, to say an awful lot of bad things happened. I'm not playing this game anymore. And I stand with, say, if you choose to do so, I certainly do. I stand with Bobby and Jay Bhattacharya and the people that are really trying to do the right thing. And, you won't be obliterated. You could actually, pardon my French, but, it's okay if you grow a pair. It's okay if you stand up and you act like a responsible adult that took an oath and has the wherewithal and the character to admit their mistakes.
Rennie has a pair much larger than most of her male colleagues.
Well, she's just a different pair, right? I mean, it's,
scaring people and you're scaring me when you say things like that. But I
Yeah,
think the point
after
that
the recent Supreme Court decision, let's not go there. But
clearly not, that's not what's happening. But clearly the issue is that it's not just okay to speak out now. It's vital that you speak out now. You know, those of us that spoke out prior to this new administration coming in, I'm not being dramatic when I say we didn't know if we were going to head to the gulag or not. Were we going to be thrown in prison for simply doing the right thing? Now, at this point in time, there is enough public support for you, and there is support from the administration that you can stand up and speak relatively freely at this point. Yes, they may target you to some extent from your institution, but they will not have the guts to come after you full-throated like they did after us, because they know that they're going to get beaten down from the other side. We're growing. And so now is the time. It's vital for you to speak out.
right,
Yeah.
absolutely. And you know what? There's always value in it because we're still a minority of people speaking out. So, in a sense, you're not cutting edge, but you're still ahead of the curve. Speak out and tell your patients. That's the other thing. I tell every one of my patients, and now I'm at the point now where it's like, yeah, doc, you've told me that 2 or 3 times, but I tell them, I want you to absolutely be circumspect about any and all treatments that you get. And I tell them I do not trust the mRNA platform in any way, shape, or form whatsoever. Period, full stop, end of story. And I don't care who knows it. And, it's gotten to a point where my patients say, yeah, you told me that, I know. And you know what? The number of people who push back is so small now. I mean, it's virtually zero. It's virtually zero.
Well,
Going back to Dr. Sarah Brenner, I look at this guy, Scott Adams, who is a huge news person, extraordinarily powerful, massive. I think he's got over 2 million followers. There's a man with that less than 1% of the population is able to do. He comes out and says it. I was dead wrong. I owe the public an apology. I was pushing the vax. The winners in this are the anti-vaxxers who knew from the beginning, and I doubted them and I mocked them, and I'm totally wrong. Less than 1% of the population has the intellectual and the ethical integrity to say that, and I respect them wholeheartedly. And I would urge all of our listeners, everybody in the world to come out, because that elevates you on a platform above the rest of humanity, in my opinion.
I agree. And I think, the other thing that I try to be as good a Christian as I can. And, you realize that all of us are flawed human beings. All of us make mistakes. All of us screw up. Some people did, some people acquitted themselves pretty darn well during COVID, and some people didn't. But the whole point of redemption is to stand up and be counted for when you
Repent.
realize what's happening.
Repent. That's right.
That's right.
And as a follower of Jesus Christ, actually nothing has brought me more liberation and freedom, to publicly admit that I was wrong, and I repent and apologize. I didn't come along as early in my career as you did, right? As either of you, both of you. And, I pushed the vaccines. I'm a disabled military veteran. Goodness gracious, I've taken more vaccines than probably both of you put together. I vaccinated my kids. I pushed the vaccine in pregnancy up until 10 years ago or 15 years ago. So I've apologized publicly for that. And, to me, and apologizing, repenting, that's what being a Christian and a follower of Jesus is. To be able to repent and turn around and acknowledge that publicly.
Yeah.
We have just a few minutes left, and I'd really like for you, Dr. Clayton Baker, to leave our incredibly audience. We have an incredible audience, faithful audience, and give them some points of reference, some advice, and some points of action. and then we'll close out
Sure. I would
with
say
your remarks.
Sure. Thank you. Thanks for the opportunity. I would say there's three things that I would say. The first is, as we've been saying in detail here, it doesn't matter who you are, speak up and speak out. Okay? It's okay to speak up and speak out and about whatever you think is the truth on this matter. Inform yourself, but that's possible for anybody to do. If you need, I'll put in the shameless plug. You can inform yourself with my book if you want, but there's plenty of other good books out there. There's Jim's book too, which I'm looking forward to reading as well. But and incidentally, I thought your testimony recently it got rave reviews from people I know, Jim. So at Senator Johnson's hearing. But anyway, I think speak out. It's okay to speak out now. People, as Rennie has said, as you said, the time is right now. Okay, it's not just about repenting, but it's about speaking out, speaking the truth, and saying, "Look, I'm not going to do this." So when you say, if there's something that you think is wrong, and you say, "I'm not going to do it," that stiffens the spine of the people around you. So I think that's the first thing. I think the second thing is, I happen to be, and I know there's people in the movement that think that the secretary is going too slow. I think that Secretary Kennedy is doing everything he's able to do now. I think he is doing yeoman's work. It's going slower than we want, but we're making tremendous progress. And I really encourage people to the fullest extent that they can, not go after the guys who are on our side, even if you don't feel that they're not working fast enough. There's plenty of people that are getting it, that are trying to throw stones in his pathway. And those are the people that you criticize, not the people that are trying to do the right thing. So really, it's the old, I'm not much of a rap fan, but fight the real enemy, right? I mean, the people that are really trying to perpetuate this are the ones that we need to oppose, not the people that are doing what they can to improve it. I think the third thing that I would say is be educated. And you go into your doctor and you say, "Look, I'm not going to accept something blindly. So you're going to have to give me the package insert, and you're going to have to give me a couple of days to read it through and figure out what's going on. You're going to have to safeguard your own health." And every time a doctor goes in there, a patient goes into their doctor and says, "Look, I'm not taking anything as an article of faith. No offense, but that's just the way it is now." I think that you force your physicians to be better informed themselves. You force we talked about what's going to happen with the future of medicine. You hold people to a higher standard. You don't say you're the expert. You say, "Look, tell me what you think is the right thing to do. Provide me with the information, and you make sure, I guess, in short, that you get true informed consent every time you submit to something." And that's just one of the lessons of COVID, is you can't assume that you're going to get that unless you demand it. And those would be the things that I would really recommend.